Fetal kicking and movement, what it means for baby's health. Welcome to Kids Healthy Tips. Today we'll explore the significance of fetal kicking and movement for your baby's health. We'll discuss what constitutes normal versus abnormal fetal movements, how to track and count fetal kicks, and when to seek medical advice. Join us for essential insights into monitoring your baby's activity in the womb. Understanding fetal kicking and movement, key indicators of your baby's health. Hello everyone, I'm Dr. Susan, and today we're going to delve into the world of fetal kicking and movement. These movements are not only a magical part of pregnancy, but also critical indicators of your baby's health. Let's begin by understanding what normal versus abnormal fetal movements look like. Normal vs. abnormal fetal movements. Fetal movements typically start as flutters or gentle kicks and become more pronounced as the pregnancy progresses. Here's what you should know about normal and abnormal movements. Normal fetal movements. Most women begin to feel fetal movements between 18 to 22 weeks of pregnancy. Movements are usually more noticeable after meals, during certain times of the day, or when you're lying down. It's normal for the baby to have periods of rest and activity. An active baby might kick, roll, or stretch frequently. As the baby grows, movements may become stronger and more distinct, such as punches, rolls, or even hiccups. Abnormal fetal movements. Abnormal fetal movements. Decreased or absent movements could be a sign of distress. If you notice a significant reduction in activity, it's crucial to contact your healthcare provider. Sudden, violent, or prolonged periods of frantic movements might also indicate potential issues and warrant medical attention. Every baby has its own pattern of movement. Changes in your baby's established pattern can be concerning. Tracking and counting fetal kicks is a useful way to monitor your baby's health. Let's discuss how to do this effectively. How to track and count fetal kicks. Kick counting is a simple yet effective method to ensure your baby is active and healthy. Here's how to track and count fetal movements. Choose a time. Pick a time of day when your baby is usually active, often after a meal or in the evening. Ensure you are relaxed and in a comfortable position, preferably lying on your side. Count the kicks. Set aside time to count how long it takes to feel 10 movements, including kicks, rolls, and flutters. It should take less than 2 hours to feel 10 movements. Most babies will move 10 times in less than 30 minutes. Record the results. Keep a journal or use a mobile app to track daily movements. Note the time it took to feel 10 movements and any patterns you observe. Know what's normal. Familiarize yourself with your baby's typical movement patterns. Understanding what's normal for your baby will help you identify any significant changes. While tracking fetal movements is important, knowing when to seek medical advice is crucial. Let's discuss when it's time to call your healthcare provider. When to seek medical advice regarding fetal movement. Here are some scenarios when you should seek medical advice regarding fetal movement. Decreased movements. If you notice a significant reduction in your baby's usual activity level, contact your healthcare provider immediately. Reduced movements could indicate that the baby is not getting enough oxygen or nutrients. No movements. If you do not feel any movements for several hours, especially if you're past 28 weeks, it's essential to seek immediate medical attention. Your provider may recommend a non-stress test or an ultrasound to check on your baby's well-being. Changes in movement patterns. If your baby's movement pattern changes drastically, such as going from being very active to very still or vice versa, inform your healthcare provider. Consistent monitoring can help ensure timely interventions if necessary. In conclusion, understanding fetal movements and knowing how to track and respond to them can greatly enhance your peace of mind and ensure your baby's health. Regularly monitoring these movements and seeking medical advice when necessary are key steps in a healthy pregnancy. Thank you for joining us as we explored the importance of fetal kicking and movement. If you found this video helpful, please subscribe to our channel for more insights on pregnancy and parenting. Share your experiences and questions in the comments below. Until next time, stay connected with your baby.